A lot of people talk about birth plans, okay? Writing up a birth plan. In your birth plan, you're stating all of these things that you would like to either have done or not have done. You might say in your birth plan, I don't want to be hooked up to an IV. I want to have the lights dimmed. I don't want to have interruptions. I want to be able to walk around in my own clothes, not a hospital gown. You might have all of these different things, and the hospital staff doesn't, they don't love to see birth plans. That to them is like, ugh, this is going to be a, a pain where, this person is going to be requiring all these things that we just are we're not necessarily going to be able to accommodate. Okay, so there's an example. So in a class like that, the hospital's not going to say, okay, so let's go over how to write a birth plan, because they don't really want you doing a birth plan. Okay, like I said, that's just an example. The hospital is not going to focus a lot of time and attention on how you can be a more proactive patient and be more on top of what your care is going to be, lest I say more of a challenge or a challenging patient, okay? So that's another thing. So hospital classes, they're also not going to spend a great deal of time on pain management. I mean, they might talk a little bit about breathing and so forth, but in a like a bigger class that has like more in-depth detail and so forth, and on topics like that, you're going to literally be put in positions with your partner, with pillows, on a birthing ball. You're going to do all these things to give you ideas, tools to remember when you're in the birth process to try and get through it as best as you can, more comfortably, in a more relaxed state. So that takes time and effort to go over all of those things. So not everybody wants to do that. Okay. The other choice that I didn't mention is you could buy a DVD and study that way. Now, this is an excellent choice for you if you want to know about the birth process. Now, I think this is a really funny movie for pregnant couples to watch, because who's at the door? Go away, you. Come here, come say hi. My little mushka push. My kids haven't interrupted my show in such a long time. They used to always burst in. But I'm in the middle of a thought, so.
I'm just getting the computer.
Go. Okay, go. Ooh, you're all sticky. So, I was just saying that this is kind of a funny example because in this movie, the dad has all like best intentions of like, he buys like a stack of books and he's going to read all of everything he needs to know about birth, and he doesn't get through any of them, and they end up being like shoved under the sink. So I think that happens to a lot of people, that they're kind of like, well-meaning about learning this stuff, and then they don't go ahead. However, at some point in her labor, he does mention a mucus plug, so he had to have done some reading to know what that is. Can you stop making noise? What are you doing?
Sorry, I'm just trying to get the plug.
Go get on the bed to pull the plug out. How about this? Laugh and learn about childbirth. This is a 2-disc DVD set here, which is basically what I'm talking about, a childbirth education class, except it's all on DVD. Evie, really?
I'm getting it.
I've heard people say not so great things about this. I mean, I think she gives great information, like everything that she's talking about is, okay, you're making me nuts. Why is it, sorry, I'm back. I think the information she gives is great. I mean, it's, everything that you need to know about childbirth. The weird thing is, though, I really think that it's better to do this kind of thing in a classroom environment. For a couple of reasons. I mean, you get to hear other people's questions, their concerns, and so forth. It's interactive. You can interrupt and say, oh, wait a second, I have a question about that. Obviously, you can't do that with a DVD. And you get to meet other people. You're in a room full of people who are all giving birth around the exact same time that you are, so that's nice as well. Usually you do a childbirth education class at the beginning of your 3rd trimester. Okay, so especially if it's like an 8-week class. So you want to build in enough time so that, you know, you have everything down before you actually give birth. I see what my timing is. I think I'm running out of time. So, you know, doing it in class setting, like I said, I think is a better idea. But sometimes you just can't. You do not have the opportunity to do that. So doing like a DVD series is better than nothing. Okay, so let's go on. Let me just tilt the camera a little. What I want to show is more the anatomy right over here. Just, you know, looking at a kind of a cross-section of a pregnant woman, and just kind of understanding that this is the uterus. This is something you talk a lot about in childbirth education class, the uterus, and the bottom of it being the cervix. Okay, you get a lot of that also in a class, or, you know, your doctor or your practitioner will be talking about the cervix. It's really just the neck of the uterus. The uterus is like a big kind of a sac. It's small, like the size of a pear when you're not pregnant, and when you are pregnant it grows and grows and grows to accommodate the size of a baby. As it grows, you can see it pushes aside everything else, and that's why pregnant women are uncomfortable. It's not because they're fat. Don't ever use that word around a pregnant woman. It's because they're not only carrying around a lot of weight, but all of their internal organs are completely mushed and pushed aside. So you can see like their stomach and intestines, everything's kind of pushed up, and then there's a lot of pressure down here on the bladder, and that's why pregnant women have to pee a lot. Okay, so it's helpful to understand what's going on inside of your body, so it's not a big mystery. And again, understanding the uterus and the cervix being the end of the uterus, which stays closed very tightly, okay, during the entire pregnancy. Your baby is extremely well protected in there. You know, it's closed tightly, and inside of that is the mucus plug, the aforementioned mucus plug that I was talking about. And as you go into labor, and one of the first things that typically happens is the cervix starts to soften. And as it softens, that's the mucus plug sometimes comes out a little bit, which shows itself as just kind of a bloody discharge. So, you know, there's a lot of things going on when you go into labor. It's not just sensations, you know, there are other things that are happening to you. So when you go into labor, the cervix is opening and thinning, and your doctor will talk about that as well. So opening is dilation, and thinning is effacement. So let's just talk briefly about the 3 stages of labor.